Today, we are going to learn how quality improvement methods can be used to approach population health and panel management in the continuity clinics. This module was developed for the Michigan Medicine Internal Medicine Residency Program by Dr. Amanda Cox of Brighton, along with Tammy Ellies and Katie Gribb of the Internal Medicine Quality Improvement Team. In this module, we will review the session objectives, talk about population health and panel management, walk through quality improvement and scientific problem-solving methods, and do a few activities. At the end, there will be a survey to complete. At the end of this session, you will be able to define the components of panel management, review individual and site-level panel data, understand how quality improvement concepts can be applied in the clinic, and set a SMART goal to improve on a single focus measure. First, let's talk about population health and panel management. What is population-based care? A population is a panel of patients that is associated with one provider or one clinic. Population-based care is a proactive approach to healthcare, or a systems approach to primary care. A systems approach involves collecting data to identify and monitor those who need care, finding and implementing the latest care guidelines, and involving your office staff, nurses, other physicians, and other caregivers in evaluating and improving your performance. Panel management is concerned with the entire population of patients rather than only those patients who happen to come in for appointments. It's a systematic approach to identify and address all of your patients' unmet preventive and chronic care needs. Why should we do population management? Think of it as repairing the roof before the storm comes in. We are taking a proactive approach to medicine rather than a reactive approach. We know that the prevention of chronic disease is the foundation of a long, healthy life. This work can prevent the development of chronic disease, and in populations that have chronic illness already, tracking and addressing gaps in care ensures that all patients are getting what they need to help them enjoy longer and healthier lives. What are the components of panel management? It starts with a registry of patients assigned to a provider. The foundation of panel management is using established clinical guidelines and goals to enable proactive monitoring of a panel of patients. To allow this, the system collects data that identifies where care gaps exist. Then the system has workflows, including best practice advisories, standing orders, and the like, that support highlighting and bringing forward preventive measures based on the identified needs of patients. Panel managers are at each clinic site to help monitor primary care populations, and it's important to include all members of the care team. Finally, there are a variety of in-reach and outreach activities that work to close the identified gaps for a panel of patients at both clinic and provider level. How do we approach the work of population management? By using both in-reach and outreach methods. In-reach ensures that patients who are in the clinic are offered preventive and routine services during the visit, regardless of their stated concerns. For example, a patient with a urinary tract infection visits the practice. During the appointment, in addition to addressing the primary reason for the visit, the medical assistant reviews the health maintenance screen and identifies any overdue immunizations or cancer screenings. The patient can receive the immunizations and schedule the cancer screenings before leaving the office. Outreach involves contacting patients who do not have scheduled visits to offer them needed services. For example, a patient with emphysema who is due for pneumococcal vaccination can be identified by the panel manager and contacted to get this done in between appointments. All members of the care team can be part of these efforts. It's a proactive approach to medicine. Here at Michigan Medicine, we have these components in place for a set of metrics that are referred to as the pay-for-performance measures. Using MyChart, we have automated registries of patients assigned to sites and individual physicians within the sites. Reports such as the one you see here can be accessed by panel managers, clinic managers, and physicians to review performance and identify patients with gaps. The reports include the measures, current performance, and goals. We have clinical guidelines for these measures, and in many cases there are best practice advisories or decision support tools that appear in the chart when a patient has a gap. Established workflows and standing orders help the clinic staff to address these gaps. Members of the care team, including panel managers, medical assistants, and physicians, all play a key role in helping the patients understand the recommendations and take action to address the gaps. Additional outreach activities such as phone calls, MyChart patient portal messages, and letters are also used to address gaps for patients who may not have an appointment coming up. We continuously strive to improve the care gaps for every patient and every measure utilizing established workflows. However, in order to prioritize limited resources and time, the medical group chooses several measures to focus on each year. These measures may change from year to year and are usually measures where we are performing below our desired goal. The focus measures are often allocated additional support from quality improvement managers, IT, and other support areas so that new and innovative ideas can be tested, all with the end goal of improving care for our patients. In order to incentivize and recognize sites for improvement in these measures, money is paid out to each site based on improvement in the focus and pay-for-performance measures over the calendar year. The panel manager, clinic administrative manager, and attending physicians at your site can tell you the focus measures for this year. Now, someone will hand out your personal panel reports. Please note, you may not have individual data for all the measures. Specific criteria is applied to determine which patients qualify for each measure and how the patients are assigned to you. There is an individual rate, a site rate, and a UMMG rate, along with a 75th and 90th percentile goal. This data has a 2-month lag time. At this time, take a few minutes to review your report and see where you are performing well and where you might have opportunities for improvement. Please pause the video now until the activity is complete. So, if we want to improve one of the focus measures, how do we get started? We start with quality improvement tools. Quality improvement methodology starts by clearly defining a problem and verifying that it is a problem. Next, resources are developed for the project, including establishing physician leads, identifying process owners, and engaging stakeholders. At this point, it is very important to scope a project well, defining what is within your control to make improvements on, and identify what is out of scope. As you work to assess the current state, identify gaps, develop a future state, and implement countermeasures, you can use a tool called an A3 to guide your thinking throughout the project. This methodology can also be referred to as scientific problem solving. The A3 tool is generally used to guide the project work from this stage on. A3 just refers to the paper size traditionally used, but it's an extremely valuable way to communicate and engage with project stakeholders. The A3 evolves as the project becomes more defined and continues to transform as the group gains new insight and makes new developments on the work itself. What does an A3 remind you of in your clinical practice? There is a similarity in the approach and use of the scientific method with a history and physical and that of the A3 methodology. It follows the same logical approach that you use to evaluate and treat patients. Both of these standard formats facilitate clear communication, informed debate, and consensus building. We will now walk through an example to demonstrate how to use structured problem-solving tools to identify ways to improve a quality measure for your panel. To get started, you must pick a measure to improve. Let's take a look at the measure for pneumococcal vaccine rate for geriatric patients. The first step is making sure you understand how the measure is being calculated and what is included. This is measured for Michigan Medicine established patients, living and seen at least twice in the past 2 years, with one visit in the last 395 days. The data is attributed to site and provider seen most often, with ties going to the most recent visit. This particular measure counts patients over age 68 in order to give time to receive both vaccines. We will work our way through this section by section. Some areas of the A3 are pre-filled to assist you. Other sections you will need to fill in as you gather more information outside of this session. In the background section, you want to shed light on the situation in a way that individuals who are not familiar with the environment would understand. You want to be concise, and you should try to use diagrams or pictures to describe complexities. Here is a drafted background section around the pneumococcal vaccination rates. Does this give you some context as to the importance of the topic? After reading this, do you understand why we should work on this? If not, please take time after this session to edit the A3 to better represent the background from your perspective. You need to understand what is happening in the current state in order to know where the gaps exist and where there are opportunities for improvement. You can map it out, use visuals to illustrate what is happening, and include data to demonstrate the current state. Do not assume you know everything about the process. Go and talk to the individuals doing the work. You can ask questions like the ones you see on the screen to start understanding the process better. Here is an example of what the current state might look like for your site. Think about who you can talk to or observe to verify what is happening right now. Your homework is to verify the current condition of your site for in-reach and outreach activities around the pneumococcal vaccine. A good problem statement demonstrates a gap between what is actually happening and what should be happening. It should be described in performance terms. Often, this is a deviation from some standard of performance. A problem statement is not the reverse of your proposed solution or a lack of something. Make sure you don't include solutions in your problem statement. A good goal demonstrates the target condition or improvement that you want. It should be a SMART goal, or specific, measurable, achievable, relevant, and time-bound. It should be far enough into the future so there is time to see the effect of your interventions, but not so far out that you lose momentum and follow-up in the process. We will now pause for another activity. Please fill in the blanks for the problem statement with your individual and site-level data. Next, set a reasonable goal for personal panel improvement. Include the rate you hope to achieve and the number of patients that represents. Please note, if you do not have a rate for this measure on your report, set a goal for helping the site to improve the overall rate. Please pause the video now until the activity is complete. Now that we've established our background, the current state, our problem and goals, we need to analyze the problem. Typically, we call this investigation a root cause analysis. Like a weed, we often see symptoms of a problem because they are more obvious and at surface level. But the underlying causes of a problem are usually below the surface and not as obvious. One way to perform a root cause analysis is to do the 5 whys, basically digging down to a potential root cause of the problem by asking why until you really cannot ask it anymore. By performing the 5 whys and digging down, you can get to those roots. The example A3 in front of you demonstrates how you might start a 5 why analysis for this problem. There are some potential reasons identified for why there may be a gap in performance for pneumococcal vaccine started for you. As homework, add to this analysis and come up with your own assessment of why gaps in performance exist. After you've spent the majority of time working through the left side of your A3, you can get to the right side. This is where you can make recommendations for interventions, plan for changes, and follow up on your actions. Essentially, we move from diagnosing the problem to treating it. An intervention or countermeasure is a suggestion or hypothesis for a change that will move you closer to the goal. You will generally need to run tests of change or experiments to determine if a countermeasure achieved the desired effect. These are called plan, do, study, act cycles, or PDSA. Projects typically go through many cycles of PDSA before being completed. At the end of this session, you can begin to brainstorm ideas of things you can try to make improvements for your panel of patients. Please utilize the panel manager or medical assistants at your site for support. You can meet with them separately as well to discuss specific patients and interventions. Lastly, you can utilize the remaining section of the A3 to plan your cycles of change and keep track of your improvements. In these sections, think about what you will do, by when, and who can help you. Continue to fill these sections in on your own after you know what things you are going to try. Panel management allows for a proactive approach to patient care. Quality improvement methodology provides an opportunity to systematically manage your panel of patients. In combination, we can have an impact through measurable improvements. Continue working on this. You will review your progress in September. Please take a moment to complete a short survey on today's module. Now that you have established a goal, take the remaining time available to brainstorm potential next steps and recommendations you can come up with to improve the pneumococcal vaccine rate within your panel of patients.